Myntri katanat Koit Khiah James PK Sangma menta ka Arpsantrik Rimpang Archal Arpuar ulayo benpli ka Phase 2 jang ka Indian Council of Medical Research ICMR STEMI Act Pinewood Hotel Shillong. Habay crench kilat patay kubor Myntri ka Koit Khiah ulaong baling ba kani ka ICMR STEMI Act shibun kinyo jingirap na kani ka jingpang heart attack kamtam gitu kilong ying ki baduna kayo kokon bakinyo ka jing sumar a. Kipat ba akila banyo ikani kalat jing sumar na po ko hospital Negrims badru aki pratli ki hospital sarkar but ki hospital Shimen. Shushu na kalyang katanat ko Koit Khiah kan IA lani no sinyang ki ECG shaki hospital ki bampat don ikini ki tiar jing sumar. Hakani ka singi la don lang ka commissioner and secretary katanat ko Koit Khiah ka MN Nampui ka secretary katanat ko Koit Khiah ka kong RM Kurba but director katanat ko Koit Khiah Dr. Amanwar lembat kiway day.
Heart attacks, as everybody understands, the myocardial infarction that happens, especially the STEMI variety that Dr. Malviya had expounded upon, is a very, very fatal condition, but amenable to treatment if treated within the first 90 minutes, the golden period that he mentioned. So this particular project, wherein I would say it's a matter of pride for Meghalaya that we have been chosen as the hub for the Northeast region. And the Department of Health has been extremely cooperative. We have had support from 8 hospitals within Shillong to serve the people of Shillong. And this medication, which is pretty expensive otherwise, will benefit especially those who can't afford it. I would reiterate that when somebody has a heart attack, some of which can be treated through intervention but some require this medication, unfortunately because of the time taken to reach the hospital and also some patients not being eligible for thrombolysis, despite the expensive medication, they do not get the benefit because at times they reach hospital where they may not have a cardiologist at hand immediately. Now, technology marrying with healthcare delivery here, where immaterial of whether a cardiologist is present or not, the minute a patient reaches a hospital, the ECG is taken by the technician there. Every hospital has an ECG machine, even a primary health center can. That ECG record through this dedicated app is sent to Negrims, where our cardiologists are available 24/7. Round the clock. The minute the ECG comes, they analyze the ECG and tell the peripheral spoke whether this patient merits or does not merit the thrombolytic agent. And if the patient merits, then the thrombolytic agent is administered within minutes. So it takes just that transfer of the app, the ECG on the app and the decision taken in minutes. So within the golden period, we can save many lives. I'm extremely happy that we are able to offer this to the people of Meghalaya. But I will also reiterate that the first, or primary way of getting, rid of heart ailments is precautionary. So we must emphasize on lifestyle improvement. But for those who are unfortunate and get into trouble, we have a solution. And the solution is now available in 8 spokes. And I would like to express my gratitude once again to the Honorable Minister and to the Department of Health for cooperating with us at every stage, because not very often do we all get together like this. And I hope to do this in other areas of healthcare delivery where we can all work together as a team rather than independent centers.
I'm Mishra Ji, the HOD of the Cardiology Department. Dr. Amit Malviya, the Principal Investigator of the project. From Kurba, our Secretary from the Health Department, Dr. Amanwar, our EHS MI, all the health officials from Negrims and from Government of Meghalaya, and our members of the press fraternity gathered here for this inauguration program. A very good morning to each and every one of you. This is indeed a really proud moment for me as Minister in charge of Health, Government of Meghalaya. And I would like to first and foremost place on record our sincere thanks to Professor Nalin Mehtaji and his entire team at NIGRIMS, ICMR, and also, of course, our officials and our doctors of the Health Department for, to borrow the words of Professor Mehta, to bring about this marriage of technology and medicine and bring forth this intervention, which I have full belief and faith that this will bring about an environment which will save so many lives in the future. And for this, we are indeed very grateful to Professor Nalin Mehtaji and his entire team for having come up with the ideas and for having partnered with the Government of Meghalaya to bring this about. As we have already heard from Dr. Amit Malviya and also from Professor Mehta, that this is indeed something of a need which was urgently required. And I think that it's not just about the fact that the medicines will come free of cost, and these are very expensive medicines, mind you, costing from about 20,000 to 25,000. And these expensive medicines are sometimes not affordable by many people, especially economically weaker sections. And it's not just about the fact that these medicines will come free of cost, but the fact, as was already explained to us, that in an instance when we are all rushing for the golden period of 90 minutes, wherein a cardiologist is not available, that is that point of time where a matter of few minutes here and there can cost the life of a person having cardiac arrest. And this is really something that by bringing technology, by having an app which will ensure that the ECG, whichever is taken of the patient, will be referred to the cardiologist at NIGRIMS, and immediately within a matter of few minutes, whether this medicine can be administered or not will be prescribed by the concerned cardiologist. This is something that really, it's so simple when we look at it, but in terms of effectiveness, it will really go, I believe, a very, very long way in making sure that we will be able to save countless number of lives. As we have already heard, that this system has been given to us by ICMR, and indeed we are very, very fortunate that the hub for this region has NIGRIMS has been selected as the hub. And we are also very happy that 8 spokes will be part of this system of hub and spoke, and these 8 spokes will be the Civil Hospital of Shillong, the Ganesh Das Maternity and Child Hospital, the Reed Provincial Chest Hospital, the Dr. H. Gordon Robert Hospital, Nazareth Hospital, Woodland Hospital, Supercare Hospital, and Bethany Hospital. These will be the spokes where these medicines will be available. The only thing which will be required is the uploading of the ECGs and the necessary diagnostics for reference to the cardiologist at NIGRIMS, who will authorize the use of this medicine, which will save lives within the golden period of 90 minutes.
Is that out of 100 patients who are eligible to get this medicine, only 30 of them actually receive this medicine because of various reasons. The most common reason is being presenting late to hospital. Second common reason is doctors not being able to confidently diagnose that it is ST elevation myocardial infarction. Third is the hesitation to give this medicine because it's a clot buster. It's a strong medicine. It can lead to bleeding. So sometimes doctors are hesitant to give. And there are many more reasons, and one more important reason is the cost of medicine. So the rates of thrombolysis countrywide, including our state, is around 30%. And what we aim to do in this project is to increase this rate of thrombolysis, because the earlier you give this medicine, the more is the benefit, the more is the chance you can save life of patient.